Hello everyone, welcome back to my channel, that is Gynaecology Simplified. In last videos we have discussed about ovarian cycle, feedback loops and also the menstrual cycle. Now we will start with endometrial cycle, that is what are the changes that takes place in the endometrium during the menstrual phase or menstruation. Also it takes place monthly, so every month during a reproductive phase of the reproductive female, okay, this cycle takes place that occurs in the endometrium. So we need to know what are the changes that occurs in the endometrium, that is called as endometrial cycle. So before knowing what happens in the endometrial cycle, we must know what are the structures or what are the glands, what things are present in the endometrium, what are the blood vessels that are present, and what are the structure. So mainly basically we need to know the structure of the endometrium to know what exactly occurs and what sheds during the menstrual phase so that bleeding occurs or menses occur. So let's start coming to the structure of the endometrium. First let's write it down something, that what are the structures. First you can see the picture here. I will just zoom it for you. See, this one is the, see here, you know, this is the image of the uterus with fallopian tubes and also ovaries. So this is the uterus, okay, and this is the ovaries and this is the fallopian tube. So this is the fundus, this is the uterine cavity, and this is the enlarged view that is shown in that picture. The right side picture that is shown, the enlarged view of the, this is the perimetrium, this is the myometrium, and this is the endometrium. Okay, so what is the structure? See here, this constitute the perimetrium. See, this is the outside, the outer thing is the perimetrium. Then the middle one is the middle or muscular layer is the myometrium, and this is the endometrium or the superficial layer, or into the endometrial cavity the layer that is present is the endometrial cavity or endometrium. So endometrium consists of two main stratum, that is stratum functionalis and stratum basalis. The basal layer that is present here is the, towards the myometrium, is called as the stratum basalis, and the superficial layer that is present is the stratum functionalis. Okay, these are the basal arteries that goes till what, this is the branches of the uterine vessels. See, this one is the uterine artery, then it gives branches, that is the basal artery, and then also this layer is the spiral artery or coiled artery. Okay, and here there is presence of crypts. Okay, and from there this is the epithelium. Okay, and from there the glandular secretions are drained and a slimy layer is formed, that is the endometrial cavity. Okay, so what are the layers? Perimetrium, myometrium and endometrium. Endometrium is divided into stratum basalis and stratum functionalis. So basically the stratum functionalis contains the spiral artery. Okay, I will tell you the significance of the spiral artery later, that is this spiral artery due to its constriction. Okay, there is degeneration of the superficial layer, that is stratum functionalis, and shedding of the stratum functionalis leads to menstruation or menses. Okay, the bleeding occurs due to shedding of the stratum functionalis only. Stratum basalis does not shed. Why? Stratum basalis is present here because that will help in regeneration of the stratum functionalis after the menstrual cycle is over, that is from day 1 to day 5 average. On an average, when the stratum functionalis is shed off, then stratum basalis will help to regenerate the stratum functionalis. Okay, and prepare for the next cycle from day 5 onwards. Then comes the proliferative phase, that is the stratum functionalis will proliferate, and then it becomes stabilized. At what time? When there is ovulation, and then there is production of progesterone that will again stabilize the endometrium. And after stabilization, when the spiral artery could not provide what? Could not provide blood to the layer of the endometrium. Why? Because spiral artery, the vessels, depends on progesterone. So, due to withdrawal of the progesterone or due to atresia of the corpus luteum, corpus albicans is formed and progesterone is withdrawal, and the vessels that was being supported by the progesterone and that helped the blood vessels to dilate and provide the blood to the superficial layer or the stratum functionalis, that is withdrawn, and then the vessels contract or constrict and this functionalis layer is degenerated or shed off during menstruation. Okay, so understood? Then just write, we will write it here, that endometrium consists of, it is composed of stratum, composed of stratum basalis and stratum functionalis. Okay, it is composed of, it also contains what? Contains epithelial cells, stroma, glands and blood vessels. Each part is important, each part plays an important role, individual role. Okay, so endometrium is divided into basal layer and functional layer. So what happens to basal layer and what happens to functional layer? What is the role? Basal layer is the lower, see this one is the lower stratum basalis, it is the lower one third, and stratum functionalis is the upper two third, and this is one third. So see, this one is the lower one third, it is the upper two third or superficial two third. Then it is also called as stratum basal, it is called as stratum spongiosum and compactum. Okay, from the spongiosum layer itself it is degenerated. And then does this shed during menstruation? No, no shedding during menses. And here functional layer, it sheds during menstruation. At what time does shedding occurs? Day 1 to day 5 of men's shedding occurs. Sheds, that is called as menstrual phase. Menstrual phase. And then day 6 to day 13, it is called as proliferative phase. Okay, so day 3, 6 to 13, it is the proliferative phase. In between that is from day 3 to day 6. Okay, day 3 to day 7, 6 or 7, it is called as phase of repair or regeneration. That is, the basilis layer try to regenerate the what layer? Superficial layer. Okay, so that is the transition phase. Then coming to the day 15 to 28, that is the secretory phase. Okay, so what is the difference between proliferative phase and secretory phase? See what happens during, see this is the histopathological image showing, see this one, this is the perimetrium, see this is the outer layer, can't see here, so this is the outer layer, that is the perimetrium. Okay, and then this is the myometrium, this layer, Muscular layer is the myometrium, and then the whole thing here is the endometrium. This is the stratum basalis, and here the presence of gland and other things and spiral arterioles. This is called as the stratum functionalis, and this part sheds during menstruation, and this remains. Okay, this remains, and that helps to regeneration, that helps in regeneration of functionalis. Okay, understood? So this is the perimetrium, myometrium, endometrium, basalis and functionalis layer. Okay, understood? Then where were we were at the difference between proliferative and secretory phase. Okay, we'll write what happens in proliferative phase. I've told you, during proliferative phase what happens, there is increased amount of mitotic activity. Why? Because the cells are regenerating. We need more cells, so that the things we lost during the menstrual cycle we need to regenerate. Okay, so because we need to regenerate, so there is increased mitotic activity. Okay, so increase mitotic activity is increase. But during secretory phase it stops. Why? Because due to effect of progesterone. When progesterone comes into play, it stops the mitotic activity. So we call it as it stabilizes the estrogen primed endometrium during the secretory phase. Okay, here what about the glands? What happens to the glands? The glands are tall, columnar, okay, and tubular, like this. Tall, columnar and tubular, like this. And what happens to the secretory phase? The glands, these are tall, columnar, differentiated, and starts becoming tortuous. Okay, start becoming tortuous. The main thing is that the glands develop. So at a means if we take histopathological picture, if we see between the proliferative and secretory phase, there will be, we just can't see a few slides and then we just can mention that it is at proliferative phase or it is at secretory phase. We need to see what are the predominant cells. Okay, what are the predominant type of histopathological picture. Like if more amount of columnar tall glands are present, okay, with few amount of secretory tortuous glands, few amounts, or just they're trying to be secretory, just enlarging. Okay, that is proliferative phase. But that is late proliferative phase. Okay, when there is increased amount of estrogen. And in secretory phase there will be more differentiation of the glands, and there will be more tortuosity of the glands. The cells, the things, that glands will be more vascular. Okay, endometrium will be more vascular. So see, this one is the difference. It becomes more tortuous. So how it becomes, let this be the gland, it will be more vascular, more tortuous. Okay, and the cross section if we take here, it will be like this. This one is the endometrium. Okay, this will be like this, tubular. Okay, if we take the cross section, and here how it will be, like tortuous. Okay, so see, this one is the image. Just see, histopathological image. See now here. Okay, I just forgot to bring the histopathological image. I will just show you. I will show you in the next video. I'll just make a short clip and show you the histopathological image of the proliferative and secretory phase. Okay, or else if later on it will be there, I'll show you. Okay, see, then what is the next point? See here, what happens to the epithelial cells? Epithelial cells that is taller and columnar, and here again it is more differentiated in the secretory phase. Okay, then what about the stromal cells? Stromal cells, what happens? It is densely packed. The stromal cells are compact, okay, densely packed, whereas it is more differentiated in secretory phase. The thing is, or the concept is, whatever is present in the proliferative phase, they start to differentiate. Okay, they start to more differentiate, or more they get more mature. Okay, during the secretory phase, differentiated. Okay, more differentiated. And then what about the spiral arterioles? Spiral arterioles, these are the lengthening of the blood vessels. There is lengthening of blood vessels, and here due to the effect of progesterone there is formation of subnuclear vacuoles. Wait just 1 second, I will just add the image of subnuclear vacuoles. Okay, see, this is the formation of the subnuclear vacuoles. So where is the vacuoles? See here in the, this is the vacuole, this is vacuole, this is, and where is the nucleus? Here in the superficial part there is nucleus, and basal there is vacuoles. Okay, so why the vacuoles is formed? Because due to the effect of progesterone in the secretory phase, what happens, there is formation of the glycogen. There is more and more formation of the glycogen that occurs in the basal layer. Okay, the basal layer that forms the glycogen granules, and then due to deposition of the glycogen, it appears to be white. Okay, or vacuoles, the glycogen vacuoles are formed, which is subnuclear, that is below the nucleus, and it displaces the nucleus towards the superficial layer, and gradually when the glycogen granules increase, it comes to the supranuclear portion. Okay, from the basal it starts and then it comes to the superficial layer, that is called as the supranuclear vacuolation, and then gradually the glycogen granules are released in the lumen. Okay, here is the lumen and then it is released. See, this one is the lumen. Okay, it is the, gradually it is released in the lumen. See, this one is the tortuous gland. See, okay, I have shown you. Okay, this one is the tortuosity of the gland. Okay, and then what about the thickness of the endometrium during the proliferative phase? The endometrium, this is the sixth point. Sorry, sixth point. The endometrial thickness. Endometrial thickness, it, what happens, it is 0.4 to 4 to 5 mm, increases from early to late proliferative phase. Maximum it becomes 4 to 5 mm. Okay, and what about the endometrial thickness in secretory phase? That becomes 5 to 6 mm. So but you must have studied that the during the transvaginal ultrasound or during the transabdominal ultrasound, If the endometrial thickness maximum in the what? In the proliferative phase is in day 4 it is 4 mm, and maximum in day 14 it is 12 mm. So if the endometrial thickness is above 12 mm, we do dilatation and curettage in case of AUB. Okay. So what happens? Why is the difference? We are telling here, we are telling it is 12 mm, and here we are telling it is 4 to 5 mm. See, the transvaginal ultrasound, what happens if this is the uterus? Okay, if this is the uterus and this is the endometrium, this is the endometrium thickness, then here this is the endometrial thickness. Okay, what happens in the ultrasound? What this one, this 4 to 5 mm, we are measuring only one. Okay, here only from this to this we are measuring, but in ultrasound we are taking both the layers, so it is almost double. Okay, as we are taking in ultrasound, we are taking both the layers, this layer also, both this layer also, this layer also, both we are taking. But here that 4 to 5 mm we are taking only single layer, that is why both are different. Okay, so in ultrasound, if anyone asks, in day 4 it is 4 mm, and at day 12 or to day 14 it is 12 mm. And what about the ultrasound endometrial thickness or ultrasound itching in case of secretary? That is 12 to 14 mm. If it is more than that, that means we need to evaluate it. Okay, fine. Then let's go to what happens during menstruation. We will write some points. Okay, we will do, just to remember, we will write some point. Just see what is the menstrual blood consist of. See, menstrual blood is 75% of the blood loss is arterial. Okay, comes from spiral artery, and the menstrual blood clots, okay, it is lysed by what? Fibrinolysin. So if less blood is there, if less blood, then blood is not clotted, because fibrinolysin, it helps to it helps in lysis of the blood clots or the menstrual clots, so it comes as liquid blood. Okay, if in heavy menstrual bleeding, then more amount of menstrual clots are formed, and the amount of fibrinolysin is less to lyse the blood clots, so the clots are present. Understood? This is very conceptual. I hope you just get it. Okay, why we ask for the blood clots in case of taking the menstrual history? We ask if patient is passing clots during menstruation or not. This is the reason we ask, so we can know if enough amount of blood is produced or enough amount of blood is secreted, okay, in the menstrual flow, that could not be lysed by the fibrinolysin. That means more amount of blood loss is there. Okay, and then what is the total blood loss? See, total blood loss in a menstrual cycle averages 55 to 60 ml per cycle. Okay, this is the average. Okay, and if more than 80 ml, it is called as heavy menstrual bleeding or menorrhagia. Now the termination have changed. Okay, heavy menstrual bleeding, when it affects the social life of the woman, it is called as heavy menstrual bleeding. I will tell you everything. See, and 70% of the 70% of blood loss during one menstrual cycle, during a menstrual cycle, occurs in the first 48 hours. Okay, first 2 days it occurs, but continues to 2 to 7 days, continues for 2 to 7 days. Okay, so within the first 48 hours, 70% of the loss is there. More than 80 ml, it is called as menorrhagia. Then total blood loss average is 5 to 60, and the menstrual cycle, it is the menstrual clots arised by fibrinolysin. Okay, if more amount of bleeding occurs or excessive bleeding occurs, then clots could not be lysed, so there is passage of clots, and 75% of the blood loss is arterial, that is from the spiral artery. Okay, got it. Then what does menstrual blood consist of? It consists of menstrual blood consists of what? First 50 to 70% blood, obviously. Along with that, cellular debris, cellular debris, superficial layer of endometrium, endometrium, and tissue fluid. Tissue fluid. Okay, this is the okay. Then see, this is the FIGO 2018 AUB System 2 classification. Okay, what is this? See, this one is the parameters. What should be the normal frequency of the frequency should be from 24 to 38 days. Okay, this is the normal. And so if more than 38 days, that is infrequent cycles, and if less than 24 days, that is the frequent cycles. The terminologies have changed. Before it was oligomenorrhea or amenorrhea or metrorrhagia, but now it is infrequent cycles or frequent cycles. If more than 38 days, the cycle frequency is more than 38 days, it is infrequent cycle. If the cycle frequency is less than 24 days, that is the frequent cycles. What is the duration? Duration normal, it is less than 8 days. Okay, if more than 8 days, it is prolonged. Okay, so the cycle is prolonged. We say the cycle is prolonged when it lasts more than 8 days. Okay, then what is the regularity? Normal regularity, it is the shortest to longest cycle variation, that is 7 to 9 days. Okay, that means the cycle regularity, that means if this cycle, today's cycle, this month cycle to next month cycle variation, the first day of menstrual cycle to the next cycle, the first day, if the variation is, the variation of the date is less than 7 days or more than 9 days, that is called as irregular. Okay, short cycle or long cycle. Okay, then what is the flow volume? Normal. Okay, and heavy and light. Heavy means if the patient is not well socially, or it is affecting her day to day life. Okay, that is heavy. Then what is intermenstrual bleeding? That is, what is normal? Intermenstrual cycle bleeding means within two menstrual cycle, if there is mid cycle spotting or mid cycle bleeding, again that is called as intermenstrual bleeding. So there should be none. Okay, means no intermenstrual bleeding should be present to become normal. Okay, what is normal? There should not be any intermenstrual bleeding, and if any, it can be random anytime during the menstrual intermenstrual, and it can be during any time, or cyclic, that is predictable. We know that is it can be early cycle, it can occur in day 10. Okay, it can be mid cycle, if it occurs in day 14. Every cycle, between two cycle, there occurs another cycle, mid cycle or early cycle or late cycle. Okay, these are abnormal. Okay, and unscheduled bleeding on progesterone or estrogen, gonadal steroids. Okay, if the patient is on medication and if that occurs, then it is also AUB. This is the AUB system. This is system 1 classification, not 2. This is 1. 2 is palm coin classification.